Welcome. I'm going to ask us to please quiet ourselves so those joining by phone can also participate by first muting your phone. And at the conclusion of Fonda's presentation, there will be time for discussion. So just go ahead and unmute yourselves at that point. But if we could please ask that once you do ask your question, to go ahead and mute yourself again for audio. So everyone, good morning. I'm Rhonda Williams. I'm the Chronic Disease Prevention Chief, and I oversee the Tobacco Control and Asthma programs. And I'm really pleased to be here today with Fonda Ripley, who has been providing evaluation services for the Department of Health for 7 years. She's a public health consultant and evaluator with JSI Research and Training Institute. She has 13 years of experience providing research, evaluation, planning, and technical assistance at different levels, including local, state, and federal. She has worked in a span of content areas, so beyond tobacco, including maternal and child health, health promotion, and disease prevention. Today, we're going to be hearing about what I think is, for at least the tobacco program, a really significant evaluation. This evaluation reflects a lot of thought and learning, and I'm thankful that Fonda was part of our team to really spearhead this Down and Dirty evaluation. Down and Dirty was a campaign that the tobacco program implemented for nearly 4 years. It is a youth, peer, crowd, segmented social marketing campaign. Fonda will review the evaluation focus, methods, considerations, and context, and importantly, the findings. So thank you very much for joining us, Fonda.
Good morning, everyone. So as Rhonda shared, I'll be talking about an experience with evaluation for the Vermont Tobacco Control Program and one of their prevention social marketing campaigns. Before I get into that, Rhonda gave a nice introduction. I work with JSI Research and Training. I work closely with the health department. We've been working with you all our firm has been working with you all for a couple of decades now. We have an office here in Burlington, Vermont, and work closely, specifically with the Division of Health Promotion and Disease Prevention to provide evaluation services, including for the tobacco program. In that line of thinking, and considering the health department's an accredited public health department, they are comprehensive in their delivery of the essential services of public health, which includes evaluation. So evaluation plays an important role in informing opportunities to improve program and implementation and assessing progress towards outcomes and goals. So I was asked to share this evaluation experience with you all today as with the idea of giving you all a sense of the purpose and value of using evaluation to inform your social marketing or health information campaigns. And so with that in mind, I've designed this presentation to talk through a lot of the considerations that we, JSI, went through as we were planning the evaluation and conducting it. So that included thinking about what are the priority outcomes that the program wants to understand to help inform their decision making, what are the right evaluation methods for addressing those outcomes, what are some of the contextual considerations, recruitment methods and considerations, and then some of the limitations and challenges that came up along the way that you all might anticipate as well if you were to go forward with this type of evaluation. So before I get into the evaluation itself, I'm going to give a brief overview through a few slides on background on tobacco burden in the state, the tobacco control program, role of evaluation, and then I'll talk a little bit about the campaign itself because I think it's important to understand the specificity of that campaign to understand why the evaluation was designed the way it was. So to start, tobacco. So continues to be the leading preventable cause of death in the United States and in Vermont. Very relevant public health issue. Roughly about one in five Vermonters use tobacco, 18% specifically adults smoke cigarettes. estimates to be about 83,000 Vermonters. For youth, we fare a bit better. High school-aged youth, we fare a bit better for cigarette smoking, but still about 1 in 5 are using tobacco products and seeing an uptick in e-vapor, e-cigarette use, with about 12% of high school-aged youth reporting e-cigarette use per 2017 YRBS data. So that's sort of general adult and youth data. We see disparities in rates even higher among subpopulations, particularly those with lower levels of education, lower levels of income, mental health conditions, depression, and then other subpopulations such as racial and ethnic minorities, LGBTQ, and vulnerable groups such as pregnant Vermonters. So with that burden in mind, that public health issue in mind, the Tobacco Control Program has in place a multi-component infrastructure to implement tobacco prevention and control strategies. They implement evidence-based best practice strategies at the local, state, and systems level, and also to achieve their goals of preventing initiation of tobacco, promoting quitting or cessation, eliminating exposure to secondhand smoke, and identifying and eliminating tobacco-related disparities. So as you saw on that last slide, evaluation is a key component of that multi-component infrastructure, and so the program uses evaluation across components and across priority strategies to help inform their decision-making, help strengthen the program. So specifically, they use evaluation to assess implementation of strategies to understand where they can strengthen or improve. They use evaluation to assess needs for tobacco prevention and control strategies, and they use evaluation to assess progress towards outcomes and demonstrating impact. So all of that, sort of a quick primer on tobacco burden, role of evaluation, and I'll segue now into the social marketing campaign that we evaluated. So the program, back in 2013, implemented the social marketing youth segmented prevention social marketing campaign known as Down and Dirty. The campaign was aimed at the country youth peer crowd, and it was intended to disassociate tobacco use from the country peer crowd in Vermont. So that campaign is very specific, so I want to give a little more details to why it is or was as it was. So for those of you not familiar with peer crowds refers to groups of individuals that have shared culture, shared values, shared interests, likes, clothing styles, beliefs, attitudes, also behaviors, including health behaviors and risk behaviors. And so research has shown or indicates that if you target health communication campaigns towards peer crowds that speak to those peer crowds, there's likely to be effectiveness in reaching those peer crowds and addressing those risk behaviors. So that's peer crowds. Looping back to sort of the inception of this campaign, so the Tobacco Control Program is interested in addressing prevention among youth, and they were interested in targeting not all youth, but really those with disparate burden. And so when they reached out to a rescue agency, a marketing firm out of California, to do formative research on the next prevention campaign that they wanted to target towards youth, they were interested in exploring campaigns that would reach youth with most burden. And so through Rescue's formative research, they identified the country teen peer crowd as likely having higher rates of tobacco use, specifically smokeless tobacco use, and from there the Down and Dirty campaign was developed and implemented. So the campaign targeted country teens in Vermont specifically. I'm hoping the slide gives a little sense of the country teens that we're referring to. So they like outdoor activities, they like hunting and fishing and mudding and auto racing, snowmobiling, they like country music, they like Carhartt and camouflage clothing. So when Rescue developed their campaign, they identified marketing tactics and strategies to authentically reach and engage youth in the campaign, and then also use messaging that was related to tobacco-free living. So they did that through a variety of tactics, branded events, a variety of digital promotion, largely through social media, use of brand ambassadors, and video advertisements. So the campaign was implemented from 2013 to 2017. And after several years of implementing the campaign, the tobacco program recognized we've invested in this campaign for multiple years now. Have we had an impact on what we set out to achieve with this campaign? Have we reduced tobacco use among country teens in Vermont? The program had received annual monitoring reports from rescue agencies throughout that helped understand reach of the campaign, engagement with the campaign, for example, through digital metrics. They also conducted an annual survey of their Down and Dirty Facebook fans to understand tobacco use and brand awareness and appeal of the campaign. So the program had some data to work with to help think about whether they were making progress, making an impact, and to inform a decision on how to continue and go forward. But they felt limited by ultimately the amount of data that was available, essentially the sample size of the surveys and the representativeness of that sample. And so they wanted to understand more, learn more through evaluation. They also were limited by a couple of other things. They realized that we didn't know the potential reach of the campaign, so we didn't know how many country teams were in Vermont to begin with. And we also didn't have the formative research used qualitative methods, which is probably pretty common, but because of that, we didn't have a reliable baseline measure of tobacco prevalence among country teens specifically. So with that in mind and wanting to learn a little bit more and really understand what the program's impact was via this strategy, the program reached out to JSI for further evaluation. They were interested in an independent evaluation to support objective assessment of the campaign and its outcomes, as well as to build credibility in the evaluation and its findings, and ultimately we're interested in a larger sample of data from country teams that would put forth more reliable and generalizable findings. Specific areas of interest were assessing tobacco use outcomes, any tobacco use and specific types of tobacco product use, as well as whether the country teams that were part of the sample were aware of the campaign brand, had a favorable or positive response to it, and were associating it with the right message. So when JSI was engaged to support evaluation, planning, and implementation, we worked closely with the tobacco program to define the specific evaluation questions of interest to make sure that we were aligning, essentially we're giving them the information or getting the information and data that would answer their questions. And so in addition to defining the specific evaluation questions, we worked with them to define the measures that would be addressing those evaluation questions. So for example, in understanding the extent that the campaign reaches the intended audience, we were looking at brand awareness and association with tobacco-free living. I think the key priority for the evaluation was that the program was interested in understanding the effect of the campaign on tobacco use. And lastly, they wanted to understand, does brand awareness of the campaign play a role in tobacco use? And that was also built in because we were limited as we started to plan and conceptualize this evaluation. There were some limitations and contextual considerations we had to keep in mind. We were limited to data at one point in time, and so we weren't able to do a pre-post. Essentially, we had to look at data from the survey at one period of time. So to answer the question on whether the campaign had an impact on tobacco use among country teens, we were looking at brand awareness and tobacco use. A few other things came up that influenced the design of the evaluation. Relatively short timeline to implement it, so the program had wanted to be able to make a decision on how to go forward with this campaign. At the time we were planning it, it was by the end of the fiscal year because they had a new contract period coming up, and so they wanted to inform, do we continue with that contract or do we discontinue based on the evaluation findings? And so that meant there was about 4 months to plan and implement the evaluation. Ended up not being feasible. We stretched it into 6 months. But it did influence some of our design decisions. Additionally, we had thought about working with schools, but that was off limits essentially, or some resistance concern about reaching out to schools. YRBS 2017 was in the field or had just been fielded at the time, so there was concern about tapping schools again to administer another survey. And again, short timelines played a role in that as well. So reaching out to and engaging schools with that short timeline likely would not have been feasible as well. So what we landed on was a cross-sectional evaluation using an online survey. We determined a sample size of 800 Vermont teens, 13 to 19 years of age, were needed to get data that was reliable, essentially getting tobacco estimates that were precise enough to detect differences across groups. And of that 800 sample, we were aiming for 400 of those folks to identify as country teens. So identifying as a country teen was another consideration for the evaluation. Because the campaign was segmented by peer crowd, the program wanted to understand, did the campaign have an effect on that particular population, that intended audience? And so we needed to build in peer crowd measurement into our survey as well. And so we did that by working with Rescue agency who had implemented the campaign and had a proprietary tool to measure peer crowd. It's called the eye-based survey. They allowed us to use it through licensing in this study, and so we built that into our survey. And then the other piece was IRB consideration. So this, in our perspective, our view was evaluation. We were conducting the study to inform program decision making. We submit, because we were intending to collect data from youth, a vulnerable population, we submitted to the IRB for their review anyhow. They closely reviewed and came back with the IRB determination of exempt based on the fact that the evaluation, the primary purpose of the study was to assess, to inform program decision making, and the minimal risk of the study for data collection among youth was felt to be adequate in terms of this sort of data security safety guards that we had put in place. And so the IRB exempted from their role, and we moved forward. So a bit more about the survey. So I shared, we developed an online survey. We used the Survey Gizmo platform because of some of the ranking and sorting functionalities that it offered with the types of questions we were asking. We optimized it for mobile and desktop, knowing that most of our respondents would likely be accessing the survey through a mobile device, smartphone or iPad. We took into consideration the length of time the survey would take, knowing that if it took too long, people would drop off. So we were kind of stringent about the questions we were willing to keep on the survey. It ended up being about 20 questions, about 10 minutes in time to take the survey in full. Questions included eye-based questions for peer crowd measurement, tobacco use, current tobacco use, down and dirty awareness, appeal, association of messaging with the brand. And then we asked some other questions about activities and interests to understand whether they were correlates with peer crowds and tobacco use. We ended up recruiting over a 10-week period, essentially over the summer of 2017. For our sample, so eligibility required you be a Vermont resident, 13 to 19 years of age. Our recruitment strategy involved a combination of digital and print and in-person promotion. The digital promotion was essentially built out like a campaign. So we were trying, and you'll see in some of the ads I share on the slide as well as some of the subsequent slides, we were trying to design the ads and then target the digital ads so that they would, similar to what the campaign did itself, reach and engage the right audience, in this case, country teens. And so we designed Facebook and Instagram ads. We used internet-based targeting keywords that Rescue shared with us from the campaign itself, as well as additional ones that JSI provided to target ads to get to country teens specifically. We also included an option, so in that piece of the recruitment, individuals would see the ad on their Facebook page, and they would click on it, or on their Instagram feed, and they would click on it. We recognize there's limitations to how many people or what type of people are actually going to click on an ad and take a survey. So we were trying to expand recruitment beyond that. And so we also offered, for those that did take the survey, if they were willing to share that link with a network of friends, they could be opted into a gift card raffle for $100. We also tried a few other routes. We had printed flyers and palm cards that we distributed at events and venues that we thought would be relevant to the country teen peer crowd, so sporting goods stores, We went to auto racing events to recruit youth, county fairs. All in all, the print and in-person promotion were not that successful. We did have more success with the teen survey ambassadors method that we used. We had worked with the program's community partners, community grantees to post on their regional front porch forums a request for teenagers who like to hunt or fish or snowmobile or do activities that were similar to country teens in Vermont, and were willing to share the survey link, a unique survey link, with their friends or networks. And if they did that, they could receive up to $5 digital gift card for every eligible respondent they recruited, up to $100 or 20 eligible respondents. And so we did have some success with that, but it was employed later in the recruitment period. We incentivized youth to receive, everyone who took the survey could receive a $10 digital gift card. And these are some examples of the ads we were using, and it shows how it displayed on mobile device. So moving to recruitment results. So we met our overall recruitment goal. We had 857 eligible survey respondents. Most were from our Facebook and Instagram ads. 124 were from the Refer to Friends link, and then 46 from survey ambassadors. We did not reach our goal of trying to obtain 400 of our survey respondents as identifying as country teens. We ended up with 264, about a third of our sample, and 2/3 of the sample were identified as non-country through the peer crowd measurement tool. So this slide shows the outcomes probably most of interest for the program. They wanted to understand what tobacco use looked like among country and non-country teens. And here we look at it by any type of tobacco product use, as well as cigarettes, e-vapor products, and smokeless specifically. So you'll see the rates are pretty similar. And if you look at the next slide, you can see the 95% confidence intervals. If you have time to scan all that, you'll see they overlap, and there's no statistical difference in tobacco use and by tobacco product comparing country teens to non-country teens in this survey sample. The biggest difference that we see is among smokeless or chewing tobacco. So about 6% of country teens in the sample indicated they used chewing tobacco, just under 3% for non-country teens, but the confidence intervals overlap, so they're not statistically different. We also looked at tobacco use by brand awareness, and this was any type of tobacco product overall. So we looked at those who indicated they were aware of the brand or unsure if they were aware, and compared those to those who were not aware of the brand. And again, tobacco use, pretty similar, 20% versus 19%, and not statistically different. So brand awareness did not relate to tobacco use. Findings in summary, brand awareness was relatively good overall among the survey respondents. So half of them indicated they were aware of the Down and Dirty campaign brand, 53% among country youth specifically. The brand had an appeal to about 38% of the overall sample, and a bit more for country youth, 41%. Most of the sample indicated that were able to correctly associate the brand with tobacco-free living. So 73% of the overall sample, as well as 73% of those who reported as being country teens, were associating the brand with tobacco-free living. And this was an important finding for the program because they wanted to make sure that the campaign was, the intended audience of the campaign was accurately understanding the message of the campaign. And then lastly, we talked already about tobacco use. So there was no statistical difference between non-country and country in terms of tobacco use, indicating there's no disparity in tobacco use among country teens. And so that's important to understand because the campaign was developed and implemented based on that understanding from formative research that there's a disparity in tobacco use among this particular subgroup. And so while we don't have 2 data points to assess, at this point in time, we can say with fair confidence that there is no longer a disparity in tobacco use among this particular subpopulation. So all of this information in mind, the program did decide to discontinue going forward with the campaign after 4 years of implementation. I shared with you all throughout the talk a lot of the considerations that came up as we thought through the evaluation focus and the design and the methods. A few other things to think about in terms of limitations are, this is a convenience sample. We promoted our recruitment strategies specifically towards targeting country teams because we wanted to oversample essentially. So we feel like we have a good swath of country teams in our sample. We don't feel like it's representative of all Vermont youth, and so there's limitations in how you can interpret the data as a result of that. And then lastly, I'll recap. I talked through some of this as I shared evaluation design, methods, findings, etc. But I'll talk through in summary sort of learnings, considerations, takeaways, and hindsight vision. Planning ahead for evaluation. So if you're planning to implement a social marketing campaign or health information campaign, and you have the luxury or resources to do so, and know that you want to, this is a priority for your program to evaluate going forward. If you're able to conduct some baseline assessment of prevalence, in this case tobacco use, it might be knowledge and attitudes and other scenarios, for example. If you have the time and resources to collect baseline information on the outcomes of interest early on, build that into your evaluation, your resource base. Also understanding, in this case, potential reach of the campaign. So there were some estimates that were able to be put forth at some point. I think we estimated around 12 to 14,000 youth might have been reached, but this is sort of after the fact. So if you're able to have that information at hand early on, it might help inform program decision making as well. Time for the evaluation. So I had shared early on, because of the program's interest in wanting to make decisions within the fiscal year period, we had a shorter time frame for developing and implementing the evaluation. I think going forward, if you have the time, plan on at least 6 to 8 months for implementing the evaluation. If you build evaluation planning into that, I would stretch it to 9 or 10 months. And if you have the opportunity to coordinate with schools, and it's relevant to coordinate with schools or community partners, I'd build in a bit more time as well. So maybe 9 to 12 months might be a great time frame to plan and implement an evaluation for this particular scenario. Working with community partners, I wish we had done that sooner, early on in the recruitment process. They were really a great help to not only promoting the survey link in general, but also to helping with recruiting survey ambassadors. So if you have the opportunity to work with community partners, I think they're a great asset. Incentives were key to getting responses to our survey, but they also caused need for extra close monitoring of the responses because people wanted to double dip and get as many $10 digital gift card incentives as they could. So we had to monitor, for example, that people weren't taking the survey multiple times, and then we were sending out the gift card to the same email address multiple times. So we had to put in monitoring mechanisms to keep that in check, as well as we found we were getting attacked by bots at one point, Twitter bots. So we had to put in a recaptcha, I think was what we used to help mitigate that. Assessing dosage. So we had included the question on brand awareness to understand if tobacco use related to brand awareness. In retrospect, I think it would have been ideal if we had assessed dosage of campaign exposure better than beyond brand awareness. So, for example, we could have asked folks, if survey respondents, if they were a fan of the Down and Dirty Facebook page, or if they followed the Instagram feed, or if they attended any of the branded events, and that might have given us a better sense of if those who were really heavier exposed to the campaign, did that have an influence on tobacco use. Treating recruitment like a campaign, so I shared with you our strategies for targeting that very specific group and trying to design ads and profiles for targeting the ads to sort of a similar scenario that a social media campaign would be implemented. And then lastly, digital recruitment is really efficient in terms of getting a high yield of survey responses for a relatively, in a time-efficient, cost-efficient manner, but there are limitations too. It's not a gold standard YRBS school-based randomized survey mechanism. So that is everything in a nutshell. There's a lot more behind all of it. If you guys have questions or comments, I think we can open up for that. Actually, let me make a few other notes or a few other comments before I forget. First, project team from JSI was really instrumental in making this project happen. Also, close work with the Tobacco Control Program staff, the community grantees, as I mentioned, and then rescue agencies' cooperation and support with the peer crowd measurement were key to this project. So if you want to find out more, so we're going to have some time for discussion, but if you want to find out more, you can also track down the evaluation report. It's pretty hefty. It's probably 30 pages, but it is available on the Health Department's Tobacco Control Program webpage under their evaluation section. You can also email me for questions, and I don't think I have my email address on any of the slides, but it's fripley, RIPLEY, @jsi.com. You could reach out to Rhonda, and she could coordinate that as well. And for folks on the phone, if you would like to ask questions, I think you just hit *6 to unmute. So, questions, comments, reactions?
So I'm really glad that the department put resources into evaluating. I think it's necessary. We don't have to put a lot of funding and effort into something, and then sit back and say, okay, now we're going to see, what can I do to make. The tricky part of this, and it's probably the social marketing in general, in this case, it's hard to know, because we didn't know how much country teams were moving forward. So it's hard to know if we actually may have brought that down. Looks like there's no difference right now between country teams and non-country teams, but was that rate higher? Hard to know. I do have a broader question, and it might be for communication folks. Is there any evidence that any single social marketing campaign, relatively independent of other things as much as we would know, actually results in behavior change in any major health area?
Julie.
What's that?
Julie.
Self-marketing.
Self-marketing.
In the wrong direction.
Wrong direction. Yeah. So the promotion of Julie has picked up that. Okay. So maybe I guess in the other direction, that any evidence that any social marketing has ever reduced behavior.
Yes, there's a wide body of research that shows they're not always, representative to a whole sample, but especially with identity-based social marketing as well, and related to tobacco use and having ads presented to young people that with different styles and looks, that one is based on an identity that they can see themselves in and one isn't. And like across the board, this research shows that it improves the recall, the messaging, the likelihood of attending events, and reducing changing attitudes, which then is a precursor to changing behaviors over time. I mean, there's a lot of forces at work.
I do understand that. So,
Yeah.
So I'm not even necessarily expecting a yes, but that's what I'm curious about in the larger context. So I certainly can hear that it changes all the precursors up to it, and it's a conundrum, right?
I think the biggest thing with social marketing is when you make adjustments within the environment, right? So to make the desired behavior easier, with reducing barriers to accepting this new behavior. You speak to your audience, like you're coming from where your audience is at, right? In terms of what stage of change they're at, what their values and attitudes and lifestyles are. You have credible messengers that help move them along. You're reducing barriers. You're making it easy for them to accept it. There's a lot of evidence that it works, and I would be happy to share with you, Tracy, if you wanted to see some of those.
Yeah, thank you.
Yeah. I was curious one that you did not show us the list of questions you used. So I'm wondering to what extent the questions were able to differentiate which kind of tobacco use, because if I remember correctly in the beginning, one of the issues with our country use was more about chew or and less about cigarette smoking?
So the questions we used were aligned with YRBS questions. So we asked current tobacco use within the past 30 days, and we asked any tobacco use, and then we asked specifically about cigarette smoking, e-vapor, e-cigarette use, and chewing tobacco. So we were able to parse out by those three types of tobacco product use, and aligned by how YRBS asked those questions.
If I may, I'm sorry, I'm talking a lot, but I was the project manager on Down and Dirty and was involved in the evaluation with Fonda and the rest of the tobacco control program. So I feel like I have some caveats too that I want to add to this. You know, like Fonda had said, the desire to do this evaluation was because we were continuing to invest a significant amount of money, and it was difficult to know whether or not it was working. There were limitations going into this evaluation because what we really wanted to do was to be able to do a representative sample of youth and find out, okay, of all the youth in Vermont, what's the size of the country peer crowd, and then of those, what's the percentage of those who are using, and then what's their relationship or knowledge of Down and Dirty, and then to see if there was a disparity. So just a word of caution that this was great work and it was informative, certainly, for the team, and it was also qualitative in nature. So caution against making generalizable comments of like, well, now there's no disparity, but because we don't really know that. When we went into this evaluation, it was really to see like, all right, so where are we with those who we're surveying? Where are we in terms of peer crowd affiliation and tobacco use? With knowing that the limitation would be we'd never be able to make a sweeping generalization because it's qualitative in nature. So it was also like, do they know about the brand? Do they know it's tobacco free? Do they like the brand? Do they find it appealing? You know, and are we reaching country teams? Are they feeling connected to Down and Dirty? I think that we saw that. It wasn't maybe as strong as we would have liked, but, you know, 53% of brand appeal is good, is a good marker. But I would caution saying, well, now country youth are the same in terms of how much they're using tobacco use, because who are the non-country youth? Are they kids with higher prevalence? Are they kids with lower prevalence? We don't really know. It's a mix, and it could be all alternative peer crowd teams that have a higher rate of use. We don't really know, right? So there are some significant limitations. I mean, in the end, the problem persisted of the not knowing, and how many years are you going to not know and accept the not knowing and continue to put money into a program? So in the end, the tobacco control program made the decision to not continue Down and Dirty, but just
I want to respond to that, and then Claire, I'll move to you and another question here. I think Christy brings up a good point around, so where you're at, what level of peace you have with the data, essentially, and what type of decision you can make from it, what comfort level you have with the data, what credibility you have with it, and how many resources you want to put into an evaluation to help it answer a question. So I don't have the right answer to that, but I think it's something to consider. So if you were to develop another social marketing prevention campaign, definitely some learnings along the way through this experience on what you would do different next time around. But to what extent would you do a full randomized samples implementing peer crowd measurement into YRBS, for example, or a separate survey through schools to get a pretty solid representative sample with very precise tobacco estimates to answer the questions on whether your tobacco campaign was effective. We don't have unlimited resources is I guess the factor that influences that decision. So if you can get a pulse on whether you're making progress, and as an evaluator, if you can get a pulse on whether you're making progress in the right decision or getting some information to inform your decision making, I think you're in a reasonably good place. But it's not always ideal, and it doesn't make for easy decision making. Let me move to Claire. You had a question.
Yeah, I was just sort of wondering, when we think about these social crowds and disambiguating certain behaviors from the social crowd, it seems like some of those like a social crowd just is a collection of behaviors together. Like, we all wear black and listen to punk rock or whatever. So I'm trying to sort of figure out, like, doesn't it seem like to an extent some of the behaviors we're talking about in here, it's not just like, are they buying Axe body spray to perform their gender, but it's like, what, can you perform country without fill in the blank sort of health behavior? And I think that makes it very topic specific or something, because certain behaviors constitute that identity. Whereas, and so I'm not as optimistic about disambiguating some of those through the social crowd. I don't know, so does anyone have thoughts on that? Like, to what extent are some of these behaviors constituting the social identity versus can even be disambiguated?
Which was the goal of the campaign, which was that decouple specifically use of chew from what it means to be country youth. And it is more than lifestyle, it is more than clothes and music, and it was, for this point, it was getting at that value of being independent and family first, and how that is applies in the face of using tobacco.
And it was also stealth that it was the government too, right?
It was stealth that it was the government, and intentionally not co-branded to be BDH presenting Down and Dirty, but that's super uncool, and no country youth wants to hear from the Department of Health. Sometimes we just need to know what to get out of our own way, kind of thing. So it was branded to look country, and we didn't put it on our website. That's why I'm a little like, this evaluation's on our website? Do we want people knowing, like, you know, like, just anybody to go on our website and know, like, how we're targeting certain bureaucrats? I don't know.
Yes, we believe in transparent and open government.
Right. Is it a little too much, like, TMI, too? Maybe.
But,
you know, maybe
not that many people are gonna go look.
No,
As much as I would like to say.
Yeah.
It's not gonna be a hot.
Right.
There was a question in the back.
Yeah, I want to thank Claire for the question, because I think I was going to ask it a little bit more roundabout, but I appreciate the direct sort of asking about the performative nature of some of this. My question is more, why was this population chosen, I guess? Was it just because of the perception that this was disproportionately affecting country youth? Or was it the understanding, and where did those numbers come from? Was it national? Was it just for Vermont? I guess I might have missed it, but.
It was the formative research by Rescue, Vermont-specific qualitative. I'll lean on Christy if you can share a bit more on, because I know you looked at several peer crowds. Alternative had a higher tobacco use rate as well, correct?
Correct.
But you all lean, or maybe Rhonda's the right person to speak to it, but you all lean towards targeting country versus the other peer crowds. Any other insight on more?
Yeah, and actually the program also had a shorter-lived social marketing campaign with alternative young adults, yeah. And it was shorter-lived because the data internal to that program indicated to us that we weren't getting the reach that we were seeking to. So we kept Down and Dirty, however, because that 2012 formative research indicated that these two peer groups had the highest estimated prevalence and of tobacco use, and then in terms of number, estimated again for who would we be reaching in terms of quantity of use. I must say that we joke in our team that the Down and Dirty experience for us was one, we became quite intellectually engaged with it because there were so many questions around how can we know best how well we're doing with this intervention. And I can't also express enough about both the information that you glean from formative research is helpful, but then when you try to use it for evaluation purposes, it is not substantive enough. So I thank you, Fonda, for pointing out if you can
can when embarking on as large as a social marketing campaign can be, is to bring your evaluator in. We didn't have our own evaluator at the time in the program. So now if we were starting this today, we would have our evaluator there. Because establishing a baseline that is outside of your contractor doing formative research, I think is really important.
Can I just add to that? I'm sorry, I'm totally out of line, but that should be happening with every program and not just our social marketing. I mean, any time that we are engaged in trying to create change, we want to know if our programs are going to work. If we don't have a baseline, it's hard to judge the change. So I appreciate that, and I 100% support it. And it's not just for social marketing.
I do think it's not easier in other types of interventions we do because we have this gold standard of data, including breakfast and YRBS, that we can rely on more and set up those metrics of success that you're aiming to achieve through your intervention. But when it comes to social marketing, it requires additional measurement beyond, and I think that's where it gets more problematic and source of.
And I would say also that when we're looking at demographic information, you're a man, woman, transgender. I mean, I know there's some gender fluidity also, but in general, those are things that are. Your behavior is in flux over your entire lifetime. So trying to measure and to quantify those is a little bit more challenging. And also what we're aiming for is behavior changes. We all know it takes time. So to do one particular campaign for a short period of time may not instantly show us the results in terms of behavior change that we're after, but we may have planted some seeds that will, down the line, begin to shift the norms or begin to shift somebody's behavior. So we also have to look at social marketing in a broader context of it's not quite as simple and straightforward as other demographic information, as other measurements can be.
One piece. I want to move here, and then I'll go to you, Karen.
So I'm wondering if working with youth in particular, and I think in this exact topic too, because tobacco use is so coupled with perhaps the identity of the target group that we're looking at, do we ever do any sort of, I don't know what we call it, like next wave evaluation work? Because I'm sort of more curious about what impact, if any, a campaign like this might have on the youth who were ages 9 to 14 or 9 to 13 when these commercials were on, and whether or not that's going to have an impact in preventing them from ever picking up tobacco use. Because a lot of the teens may have been seeing this contemporarily with the commercials and with the campaign may already have been tobacco users and may already associate that as part of the country identity. And so do we ever do anything like that where we try to look at the long-term impact of a campaign that we've stopped?
Can we share that's being developed?
Yeah.
Do you want to
Yeah,
share
you're
that?
spot on.
Thanks, Rhonda.
Fortunately, there's a collaboration that
Can you come to the front?
Oh, sure. There's a collaboration in motion with University of Vermont Center on Behavior and Health. And there is a former lead researcher from the Truth Initiative who has years of experience in doing wave studies. And so we are creating together a youth cohort and a young adult cohort. And that will allow us, through involvement from our communications team, ADAP, HIPDIP, surveillance, to, over time, assess our interventions better by being able to test every 6 months. And we'll be able to ask questions that relate to our policy interventions and our communication interventions and assess, attitude, behavior, and use among different substances.
Not that young, though. It's still 13.
Yeah, that's true.
But eventually they would age into one of the groups.
They would age into one of the groups, exactly. And sorry, Rhonda, I didn't mean to cut you off if you were still concerned, but Down and Dirty, when it started, it did have mass media, so there was absolutely the potential for like what you call media waste. So it's like not like it's not the people that you call media waste, but it's that it's outside of your target audience, right? But after the first year of Down and Dirty, it became hyper-targeted digital-only strategy with brand ambassadors that would go to, that were part of the country pure crowd, that would be wearing head-to-toe Down and Dirty stuff at country-associated events in the communities. But the digital strategy, it would have been unlikely, possible, but very unlikely that somebody outside of the age category would have interacted with the brand.
I'm even thinking younger siblings of people who may have been part of this campaign or may have had exposure to the campaign.
Yeah, so one of the message packages that we did, which is, with a particular messaging within Down and Dirty, was related just to that, because one of the values that we found in formative research within the peer crowd was that family is so incredibly important, and particularly, and that's not true of all the peer crowds, right, that feeling of connectedness, but particularly what you're doing, your younger brother, your younger sister, or whatever, is watching. And is this what you want for your sibling, right? So it's like, I choose not to use tobacco because I don't want my little brother following my footsteps. So there is a trickle down in that way, right? So if the teens that we're reaching is less likely to use or use in front of a sibling or whatever, then, or not use because of the sibling, then that's another protective factor for the younger sibling. I don't know if that answers your question. It's complicated. It's hard.
Let me move to Karen and then you, Sharon.
Yeah, you had a slide that talks about, as part of your conclusions, advice about planning well in advance, engaging for a longer period of time, especially with schools and the complexities that come. Are there additional recommendations you would make about the part of the conversation we're having now where, for example, Claire started off with the decoupling of behaviors or the notion that is behavior change about decoupling, or is it about setting up a new identity like the Subaru brand, being outdoors, or the Marlboro campaigns used to be, speaking of tobacco, the rugged cowboy image. Is evaluation, is there a recommendation that goes all the way to the preconception, or what Christy is talking about now about the formative development and research there, or the assumptions about social marketing or marketing campaigns and sales campaigns? Is there something that evaluation has a role early on, even earlier on, in terms of, so that when you come to the end here, we have recommendations saying, perhaps you might go to this kind of approach?
If I understand correctly, I think what you're asking is, does evaluation play a role in planning to the extent of like developing the strategy and conceptualizing the strategy?
Or at least weighing in on, we all have great intentions, the best of intentions. A lot of us spend a lot of time in researching best practice or keeping up on that as it changes. But perhaps we're not, we may be doing that in public health, but we may not be doing that in sales, which is behavior change. And so does evaluation have a role in supplementing that knowledge base and then bringing a lens to critique what this data says in light of the broader world's knowledge out there?
Yeah, so yes, and maybe in some cases no, it probably depends on the scope and maybe the evaluator's role. I think for this particular scope and evaluation, and when Claire commented on, decoupling behavior versus, I didn't even fully follow, to be honest, and I would have to sit with that idea for a while and probably read about it and do research before I could provide a recommendation on it. It would not come out of what I just shared with you. So I think if you wanted the evaluator to speak to that more, to think through that more, it would sort of be, in this scenario, it would be a separate scope. But it could be built into a scope. I think what you started to describe reminded me of sort of needs needs assessment, formative research, evaluators' role in that, and doing some of that background understanding, learning, information gathering to then weigh in on informing program strategies.
And I need to plug for Kathleen, for our benefit, all communication is based on data. It's not Kathleen and I sitting in a room saying, wouldn't it be cool if we put on camo and put some kids on. That's not how communication strategies are done. In the private sector, in the public sector, all sectors, all based on data. We do extensive literature review. We figure out where the gaps in information that we have are. We could do our own formative research here. We pilot test, we tweak, we put it out there, we evaluate after to see how well it did. We make adjustments or we don't, depending on what we find. But to get to your question, evaluation is woven throughout the entire process always. So.
Well, and then how it leads to these one-off, evaluation efforts, how that links, all that stream is what I'm kind of trying to get at, so that it's also been reflected, the benefit of that is reflected in this program.
Can I just make a plug for also evaluating of our awesome grand rounds and thanking Fonda. Make sure if you did not sign in, there are sign-in sheets on the right and the left.